Okay, welcome. We're glad you could join us today for this webinar. It is being recorded and will be posted at a later time on our website, probably later this afternoon or tomorrow. We're also repeating this evening at 7. If you know of others who may be interested in participating later, please feel free to share it. I'm Janine Brinkley. I'm the Executive Director of the Appeal Center. And with us today, we have a number of the Appeal team helping to share content, answer questions, etc. So we have Jane Stadnick, who's with us, Kathleen Haig, Cindy Dooch, Anna Pacheco, and Diane Perry. So you're going to be hearing from a number of us today, as well as you may see answers to questions come in from them. Excuse me. As I said last week, I just want to remind you that we know things are changing very quickly, and we've organized the most current information that we have. Excuse me. We will also be sharing questions and challenges that arise with the Bureau of Special Education, obviously without names unless you would like us to share your name, but so that they have first-hand information from families about what's working and what's not working and what might be needed. So let's roll right into this. You do have, I'm sorry, let me just change my slide. I got to get in the rhythm here. Also, Calla Brinkley and Anya Fredrickson are on as well, and Dan Davis. They'll be helping behind the scenes. Got it. So here are just some guidelines for interacting with us today. We had a lot of questions come in during our last webinar. We hope we were able to answer those sufficiently. Some of you probably received some individualized follow-up from that because you had complex situations. We were very pleased that we were able to help with a systemic issue in one school district that was shared with us on the last webinar. So please continue to share that information and reach out to us for any assistance we can give. We do have a couple of polls that we're going to be doing in a minute. You have a question pane where you can send us questions. For those questions, we'll respond during the webinar to those we can. We may also reach out and get answers in follow-up. So you can use the question pane for that. And we will periodically pause and read some aloud that we think it would be of interest to the entire audience. If you have information or resources you want to share with everyone, so if somebody's talking about a program for X, Y, or Z and you have a link to it, you can plop that link into the chat to send it and share. Just select everyone as your audience, or the entire audience, to share that. So let's start with just a couple quick polls to see who's with us today. And our first question is going to be a very easy yes/no question, just to get warmed up. We're interested in how many of you viewed last week's poll. So let me get the poll started and launch it, and then I'll share the answers in a minute. Last week it took about 45 seconds for everybody to answer, so we'll see how we do this week. We were really pleased too to learn that last week some of our poll responses that you gave us were shared with Office of Child Development and Early Learning to let their staff know some of the concerns families have. And I believe the Bureau of Special Education is doing the same thing. So we'll continue to share the information with them as well. All right, looking pretty good. Let me close the poll and you can see it looks like 66% of the folks, sorry, 60, now I did, thank you. 66% of you viewed it live last week with us, 5% viewed the recording, and 30% did not. If you did not view it, I would encourage you to take a little time to take a look at it. The information we're sharing today is basically building on what we shared last week. So there's some good foundational information. And if you have questions, obviously we'll try to answer those as well. And one other poll, those of you who have kids with IEPs or 504 plans, can you just give us a sense of what age or ages, you can pick multiple answers here, are your children? Okay, looks like most people have responded. Take a look at this. We have a nice array, again, distribution of folks. I do want to mention those of you that have children birth to 5, we have a couple resources we received yesterday, and we understand that Octel, Sarah Holland, who's on, shared with us, she's developing a webinar similar to this, so we'll be sharing some of those resources on our COVID-19 webpage on our website if you would like some additional information about what's going on with birth to 5. Okay, and we're also going to be doing some other things for the high school and young adult audiences coming up in the future. Let's move right into our objectives. So these are the things that we're going to try to accomplish today. We want to discuss updated PD guidance to schools about special education during this time. We got some updates yesterday that we'll be sharing. We have a group of our parent advisors work together to try to put together some information to guide families in terms of setting priorities for learning at home. So Kathleen's going to share that with us today. We did a family survey. We sent it out 2 days ago, and we've gotten like 130 responses to it from all over the Commonwealth, and we collected in that survey a lot of information, but one thing we're going to share today is some things that are working for families and students. We have a few key updates related to healthcare that Anna's going to go over with us, and then we hope to be able to answer some of your questions and concerns. Okay, so in this section, we're going to be giving you the latest updates on guidance that the Department of Education, Bureau of Special Education has shared with us. I'm going to go over a part of it and then turn it over to Diane in a minute. So this was very positive to hear that during the school closure, the Bureau of Special Education is providing guidance to schools. And as we know, but one of the things that they're really emphasizing is they're encouraging schools to prioritize in a different way than they might have done prior to this circumstance. We at Peel agree with this order of priorities that you see on the slide. I'm going to talk through in a minute. And we encourage families to support their schools in applying these priorities. And we know it can be scary to think about getting special education services during this time, especially if your child has complex needs. But we want to make sure we're first focusing on safety, health, and welfare, which includes both physical and mental health. So that means that if you are ill or caring for an ill family member and you don't have the capacity to support your child in doing the educational activities, that's okay. We've gotten definitely calls from families who are concerned about that. There is additional guidance coming out that will help, I think, clarify that too in writing. Then the second priority is communicating with compassion between schools and families to creatively figure out how to deliver special ed services to the maximum extent possible. That's the message. Sorry, my mouth's not working. That's the message that we are hearing from the Bureau of Special Ed. We realize that that has to trickle down and get to a lot of people, and so you may not feel like your school's communicating compassionately, but I think the other part to this is talk first. Let's talk first before we send formal information out. So continue to reach out to us if you're not being communicated with. We hope many of you are being communicated with. I've seen some really nice examples of that, but this is still really a learning curve for all of us. And many teachers also have their children at home. They're learning to use new technology, and it's a heck of a thing to have for all of us, I think, to have to go through together. And the third priority is documentation in writing of any interim plans for special ed services provided to families. And we'll talk in more detail about that on another slide. And then lastly, compliance is a lower priority during this time. You know, I think many of us know that districts can be compliant and not necessarily be providing high quality services, because compliance is a lot about dates and timelines and checking boxes and filling in forms. But it's important to realize that although compliance is lower priority, family rights and procedural safeguards remain in place. The hope is that by slowing down, communicating with families, schools will reduce the need for dispute resolution in the future. And when it is necessary, we would encourage to use alternate dispute resolution methods. So families' procedural safeguards remain in place, but we really want to be communicating and asking for communication. So speaking of communication, we're interested, we're going to talk a little bit more. Diane's going to take over on the next slides. But before we do that, we're going to ask you what kind of school your child or children attend. So we know there are many different types of schools. So we could indicate whether your child attends a public school, a charter or a cyber charter, approved private school, private licensed academy or parochial school, and alternative education for disruptive youth program. It looks like about 64% of our audience today is families, because that's pretty consistently the number responding to the polls. And we appreciate you professionals who are on here and are wanting to share this information with other families too, because I know we're not reaching all families. Okay, I'm gonna close that poll and share. So the majority of you have kids in public school, about 18% charter or cyber charter, 10% approved private schools. And we do have a few folks that have kids in private licensed or AEDY or parochial schools. Thanks for taking the time to respond. I'm going to hide the poll and I'm going to mute my mic and turn it over to Diane.
Thanks, Janine. Hi, this is Diane and welcome everyone. So the Bureau of Special Education is encouraging to make sure that everybody, all the school districts have a continuity of education plans. And that may look different from district to district. And as a parent advisor, I'm already seeing that these continuity of education plans could be very different. The continuity of education plans, the Bureau of Special Ed did provide guidance to the intermediate units to share with the LEAs, the school districts. So the intermediate units have shared this with the school districts, and now those plans need to be submitted to the Bureau so that they know and can see what each district is going to be doing as far as providing continuity of education. Because as Janine talked about earlier, things are changing constantly. And in the beginning, there was, some discrepancy around that school districts might not do anything, but that is not the guidance. So they do need to have some type of continuity of education plan. So every district needs to submit that. The Bureau of Special Education is also doing I believe it may have happened yesterday, a recording webinar to reach the other areas of where your child may be attending. So if they're in an approved private school or a private licensed academy or any of those others listed there, there is also guidance coming out there as well, as far as what the continuity of education would be for your child if they're not in the brick and mortar setting. Next slide, please. So some things that are in development from the Department of Education is, one of them is the equity grants. And you may have heard about this because it just hot off the press within the last 24 hours. There is a link in our PowerPoint that's going to take you to what that equity grant looks like. There's the applications are out. School districts can apply for these equity grants, and it'll be for things like technology, hotspots, anything that a school district may need to ensure that there's equity of all students having access to their education during this time. There's also graduation and attendance guidance that'll be coming out that they're working on now. And as Janine said earlier, in particular, if you yourself as a parent get sick or you need to take care of somebody, what's that going to look like under the attendance guidance? And these are the kinds of conversations that have been occurring and will be coming out very shortly. They are very close to getting these guidance out. Information about how all services provided in brick and mortar schools can be provided during this time, including, so there's guidance coming out about how do you tap into school-based mental health? How do you get social work, services? And these are lots of questions that as a parent advisor, we're getting. But I will say there are some districts that are already doing it. They're already providing. So can it happen? Yes. Is it happening in your district? Maybe. And if not, it should be or could be. So again, things are changing constantly. That's why we're having these webinars and bringing you hopefully the most up-to-date information as possible. And the last thing I wanted to discuss was options to communicate notice. So I know that some school districts are already sending out and revising amended IEPs, or they're providing you the prior written notice, the NOREP, the Notice of Recommended Educational Placement, or maybe your district is sending you a letter. And I have seen all three of these options, but the school district must be communicating with you some way. Now, it's my understanding that they should be, I do want to say, I'm sorry, solicitors are also giving a variety of advice to schools around the language in some of these as well. There is a fear of school districts. Families will be requesting due process and filing complaints more frequently, but hoping that that they can collaborate with families to have it as more of a preventive approach. So the Bureau is really recommending that they utilize the NOREP process, the prior written notice process, so that families can have a more collaborative way of ensuring their child's education now and what that looks like. A letter to give notice. Attorneys are interpreting what's called Act 13 to require just providing a letter. So this may be expeditious. Families who receive a letter can request an IEP meeting and or a NOREP as a follow-up. So if your district is just getting that letter, you do have that option to request the NOREP as well. So I hope that was as clear as possible. But again, as things change, we can certainly will be updating you. And as parent advisors here at the Appeal Center, we can also assist you in that way as well, and or put any questions in the chat box. Back to you, Janine, for the next poll.
Thanks, Diane. I also just wanted to mention that we put the link for the equity grant information that was just put out yesterday in the chat field. If you're interested in taking a look at that after the webinar, of course, we wouldn't want you to divert your attention at this moment. Let's take a look at a poll. We're interested in hearing from you about what kind of written communication you have had from your district, especially written notice about changes to your child's special education services. So we want to know if you've received an amended IEP, a NOREP, or Notice of Recommended Educational Placement, a formal letter, or not, some of you may not have received anything yet. Okay. Thank you for taking the time to respond. We're hopeful that next week when we ask this poll question, we'll have a lot more folks who have received information. And just know that any information you receive in writing really should follow a conversation with the folks from the school. If you receive some notice of changes and you're not comfortable with that, you can absolutely request an IEP meeting. Regardless of whether it's a letter, a NOREP, anything like that, you can absolutely request an IEP meeting. We strongly suggest that. Also, if you receive any written communication that you would like us to look at with you and help you think about how to respond, our parent advisors are able to do that, and we're happy to do that for you. Okay. Next slide is for Cindy. Cindy's going to talk with you more. Go ahead. I'm sorry, Cindy.
Thanks, Janine. So PO has been in communication with the Bureau of Special Education to be able to share these things with parents. That's what we do. That's what the PO Center does. So this slide is going to explain some of those things that the Bureau of Special Education has rolled out and made the intermediate units aware of, so that the intermediate units can then let the school districts know. Initially, they're to review all IEPs. Now, this is the guidance that comes from the Bureau to review all IEPs. Now, teams have already met for their annual or time in between then, and what is in the IEP now is basically what's supposed to be provided to the student and what constitutes their free, appropriate public education. So there's no need to redefine what free, appropriate public education is. What we do need to document are the components of that free, appropriate public education that can be provided. So the schools are encouraged to call or video chat with families. Families remain an integral part of that IEP team, and we're to be equal partners. So the districts, along with the parents as the IEP team, need to make those decisions individually for students. I've seen some of those letters that Diane talked about, and they talk about, systemic needs within the school district, but individual decisions still have to be made individually for each student. So the components of the free, appropriate public education that can be provided need to be discussed. We're going to review IEPs, call families to engage in verbal dialogue. School districts have been encouraged to be empathetic and compassionate. If you're not finding that from your district, try that yourself. Be a model for your school. I know sometimes that's difficult, but that's what you want to try. Decisions, again, are going to be made individually. There's no need to indicate any changes in placement. There is no change in placement now. Like we've talked about previously, these are interim changes that are being made because of an unprecedented issue. When this is all said and done and we get back to the school buildings, the IEP that was in place when the schools were closed down is the one that's going to start up day one. So there's no changes in placement right now. What there is to be a focus on is looking at the specially designed instruction. Take out your IEPs, take a look at that piece. What is your child going to need while they're at home in order to receive that specially designed or in order to receive their free, appropriate public education? We're going to be looking at transition services. Again, this is going to be a challenge, but let's think about, use those creative ideas to think about what are transition services going to be like, and related services. There's a number of ways that these can be provided virtually. There still may be options for individuals to come into the home. That would have to be a decision made by the IEP team. But these are things that we really need to take a look at when we meet with the rest of the IEP team, as far as how is this going to be appropriate for my child. Annual IEP meetings should still be held. There's no reason not to have those annual IEP meetings. Yes, they're going to have to be held virtually or by phone. Remember that IEPs are fluid documents. They're never set in stone. It can have a meeting anytime to make changes that need to happen. Again, kind of talking again about what Janine mentioned about the fear of school districts, that families will be requesting due process, filing complaints. Families always have that option. Nothing changes there. So we're hoping again that, by providing this information to you and collaborating with families, that we'll be able to prevent some of those things. Not that they're going to happen, they always do happen. But we're going to work through that. Now, talking about the NOREP, Notice of Recommended Educational Placement, might be helpful to remember here that NOREP is also prior written notice. If a parent is making a recommendation that they feel very strongly about, and the school district does not agree with that, a parent may request prior written notice so that the school has to give the parent notice that they heard the recommendation, that was the proposal that was made by the parent, but they're not in agreement. So this is just a document saying that they're not in agreement, who made that decision and why they made that decision. Parents are entitled to this. But the NOREP that we're using now, there needs to be an understanding that this may not enable full implementation of a free, appropriate public education like it's described in the IEP that's in place before the schools close down. So schools have to make their best efforts to meet the child's needs during the school closures. So along with the parent coming together and talking about what does that look like for an individual child. It's important to remember that this is an interim plan. This isn't what's going to pick up when school starts back. This is just in place now. Diane talked about those options to communicate what this is going to look like. All of those should indicate that this is an interim plan, that everyone's aware that this is an interim plan. It's just happening for now. It's temporary. Programs and placements in all current IEPs will resume. So when the school buildings open, we can count on the same thing. Kids, hopefully as close as possible, picking up where they left off. But regarding those programs and placements, that's definitely going to happen. It is a fact during this time, and from the Bureau of Special Education on down, they have been made aware that children will be entitled to comp ed when school resumes. Not all children. This is going to have to be, again, a meeting that happens between the IEP team members, but there may be opportunities for compensatory ed, maybe for related service, maybe for instruction. This is something the IEP team is going to have to talk about. And something else that I did want to note regarding, what we had been talking about before about alternative dispute resolution. If a complaint needs to be filed, all of those, all of the rights that you have all remain. There's no changes in those as of right now. Complaints, it might be noted, now can be filed online. So there is an opportunity for families to file complaints online. You need to be able to provide a picture of your signature. If that's not a problem, call us at the Appeal Center. We can help you out with that. But there is that 1 year timeline to fill those, to complete a complaint if you have to, 2 year timeline for due process. So all of those things still remain.
Thanks.
And we're going to go back to Janine, have another poll for you.
Thanks, Cindy. I just wanted to mention, someone had asked the question, they said their NOREP, they were a little confused by the language in the NOREP that spoke about resuming the current IEP when school is back in session. They wanted to make sure that was referring to when the physical building opens versus when they start remote instruction in a couple weeks. It absolutely should be referring to when the physical building reopens. So hopefully districts will be specific with that as they write those NOREPs. Okay, and before we move into Kathleen sharing with us some ways to prioritize at home, I wanted to mention a couple things and give you a poll. So we've gotten some questions about PDE guidance, some specific things about timelines, related services. We'll try to answer those, but I also wanted to let you know in the chat field, we shared a link to the PDE guidance and frequently asked questions. It's very comprehensive, and they do update it sometimes more than once a day. So if you have specific questions that you think may be answered there, feel free to go and check that out as well. And our polls right now, we're going to try to get a handle on what's going on with you and your children and how prepared you're feeling to engage in this online learning. So the first question is about the type of instructional materials that have been provided to you. So technology, online instruction or practice, hard copy worksheets or textbooks, suggestions of activities at home, or none. And you may have multiple things you've received. I don't remember the responses from last week, but I think this is substantially more people have received more things. So that's good to know. And we only have a very small percentage that's not received anything yet. So that's promising as well. I think last week there was a much bigger percentage that hadn't received anything at that point. I'm going to share it. Yes, sorry. Thank you. I need my prompt. And I'm guessing from the high percentages, people have received multiple things as well, which I think is terrific. All righty. The next question, we're interested in how has instruction been delivered thus far? Wait a minute, sorry, I gotta hide. I hit the wrong button. So launch that poll. So right now, how has instruction been delivered to your child or children? Virtual, hard copy, phone call, or none? And there may be some other ways too, but we just picked these primary ones to hear about. I do know a lot of schools this week started into doing some more structured virtual instruction. Just give it a couple more seconds. Okay, let me close and share this. So looks like about 3/4 have received some virtual instruction, another third a hard copy, 18% phone call, and 18% none. So I know that's definitely an improvement as well. And the last question is about how independently your child or children are able to engage and participate in the learning activities while they're at home, from what you've seen thus far. Okay, not surprising. Few are able to engage completely independent, some with periodic check-ins. A number of kids need one-on-one instruction, and for some kids it depends on the activity, and I think that's really makes a lot of sense. Jane was sharing with us today that, you know, while her son is able to engage in the instructional activities and complete them, he needs that reinforcement at the end. You know, he needs to check in. So I think we'll see a lot of that. We also had a question about instruction, and we're going to talk a little bit more about that in this section. Oh, I didn't share the poll. I'm sorry. Here's our poll. And I'm going to turn the mic over to Kathleen and move to the next slide.
Thanks, Janine. Hi, I'm Kathleen. I'm also a parent advisor at the Peel Center. And we wanted to just talk to parents for a little bit about where do you start with all this information that's being sent home? Because I know most of you are probably feeling overwhelmed by this. This is completely normal. I have yet to talk to a parent that doesn't feel somewhat overwhelmed. These are completely unprecedented times, and these are all new experiences for you, for the students, for the teachers, the administration, everybody. And I know sometimes that feeling of, oh, this is just so overwhelming, sort of makes you feel frozen in place and I don't know where to start, and not frozen in a happy Disney way. So we just want to go through how to juggle some of these activities, set some priorities in the daily life that may just help ease this transition a little bit. So we want to go over three main things. First of all, really important to remember that you are only facilitating the instruction that has been provided to you. You are not responsible for teaching your child any new information that's coming home, or even reviewing information if it's something they've already learned and they don't understand. What we want you to do is, can you go back to, thank you. What we want you to do is take an opportunity to read through the goals and the specially designed instruction part of your IEPs, because those goals are going to give you some really good information about your child's particular needs. And it's a good reminder what they're working on. And the specially designed instruction, which is towards the end of the IEP, is going to give you some really good tips that you may be able to implement in the home. Stuff like, does the child need frequent breaks? Do they need a checklist? Do they need the information chunked into smaller bits? Does the information need to be modified? Things like that that would be really helpful for you to see if the school's providing that. And you need to also understand why it's so important to actually give this work a try. We're going to go into that a little bit deeper in a couple more slides. So next slide, please. Okay, so planning and preparation. This is a new normal, hopefully. Starting to feel like, okay, we're all at home, we're quarantined, we got to get this done. So develop a schedule Monday through Friday, just as if your child were going to school. This is going to help get you and your child prepared to learn. So maybe wake up at a specified time, follow a morning routine, eat breakfast, brush your teeth, get dressed. Now, do sweats count? Do PJs count? Well, that's up to you. Not all kids are going to be as ready for learning if they're still in their PJs. And that's just sort of a mental thing, but it's something to think about. So set up a space for learning that's conducive to your child's needs. Do they need a more sort of secluded area, free of distractions, maybe not in front of a window? The lighting, all those things need to be taken into consideration. And of course, not everybody has a perfect space in their house to set up a little schooling environment. But again, this is all about doing the best that you can do with what you have. And it's important to remember to stay active for you and the kids. It's important for everybody's mental health as well as your physical health. Get up, move around, make sure that you're at least walking outside if it's sunny, which it hasn't been the last couple days, but today I think we got some. So just to break things up a little bit. Next slide. So enrichment versus planned instruction. This is a really, really big difference. Enrichment is providing, the school's providing virtual or print material that's being sent home, and it's really just a review of what they've already been taught. They're practicing the skills that they've already learned. It's a way to make sure they're not forgetting, that they're continuing if they've already mastered it, to keep that fresh for them. So this enrichment is not new material. So you have a lot more flexibility when it comes to this kind of work being sent home. So it's not as important if your student is saying, I already know this, I'm good with this, and you can prove to yourself, yep, they already know this, they're good with it. You don't have to necessarily go through every single worksheet that's been sent home or every single online activity, but this is, again, communication with the school is going to be so critical here. So the other kind of instruction that can be sent home is planned instruction. This is new instruction. This is information your child has not yet learned. So this is typical to what occurs in the school day, but now they're using a distance learning. So it's important to understand the teachers still need to lead this instruction. They're grading the work. The students are earning credit for this. You're simply facilitating this ability for the teachers to reach your child and teach this information. Next.
Kathleen, we have a quick poll on this slide to get a sense of what folks are, what kind of instruction folks are participating in at the moment. Let me just pull that poll up and launch it. So we're interested in what are you getting in enrichment? Have you received enrichment resources and activities, planned instruction of new content, or both? Or neither, or you're not sure, and that's okay too. While you're answering this poll, someone had asked earlier if there's a timeline within which the school districts are supposed to complete their continuity of learning plans. I don't believe a firm deadline has been put out there for districts, but the goal is to have the majority of the districts have plans in place by the end of this week, which would be tomorrow. Oh, I don't know. Somebody asked if the poll is for special ed or general ed kids. I would think this would be for both. So this is, as your district's putting together a continuity of learning plan, it should first include, are we going to do enrichment? Are we going to do planned instruction? And then, or are we going to do both? And then we should be figuring out, the district should be figuring out how to make sure that in both of those circumstances, they can get that instruction delivered meaningfully for students with IEPs, students who are English language learners, students who have perhaps technology that they're needing, et cetera. So and there's a lot of conversation going on, as I understand it, about equity and how to support equity in delivering these instruction, this kind of instruction. So let me share this poll. So it looks like the majority are either doing both or just enrichment from your experiences thus far. I can imagine that, getting organized to deliver planned instruction virtually if a school district didn't already have a plan in place. Some districts had already planned for flexible instructional days, but that was only going to be 5 days. Would undertake a lot more work to do. So it's probably better that we start with enrichment resources and activities, keep kids engaged, practicing, and be planful about the planned instruction. Okay, I'm gonna move to the next slide and give it back to Kathleen.
Okay, so once you've set up your routine, you found a space for your child to work, and you've had that conversation with them, this is what we're going to do. We're actually going to give it a try. The whole, new normal kind of conversation. We actually look at the work being sent home. Okay, so whether it's been sent home, whether it's being sent home virtually or it's being sent home, hard copies or some of both, actually have a conversation with the school or the teachers, or maybe some of the therapists. Anybody at the school you need to talk to, you should be able to reach. So you want to understand what their expectations are and be realistic about what you can do at home with the school. Tell them, we've tried for days and days and we keep getting kicked off the Zoom meeting, or the material that's being sent home, hard copy, isn't at their instructional level. Things like that. That's where, when we say be realistic, be reasonable, you need to be honest with the school and let them know if this is working and if it's not working. Does the material, work for you in one format better than another format in particular subjects? These are all conversations to have with the school district, because they don't know, they're not there. They can't always determine, the child's being frustrated by this, or, hey, this is working great, let's do more of it this way. And any planned instruction of new content should be focused on only the essential learning points. So take into consideration right now, we're actually kind of fortunate that the pandemic happened now and not in September, because right now at this time of year in schools, they're usually prepping up for some testing that's being done. They're also doing a lot of field trips. They're kind of wrapping things up. So right now, if content is brand new that's going to be delivered to your student, try to get them to drill down to the essential learning points that they need to know. Not everything that would be taught necessarily in a classroom. And again, to remember, this is so important. You're only facilitating the instruction with your student. You're not responsible for teaching them the content. That responsibility is still with the school district. Next slide. So ready, set, let's just give it a try. So sit down with your child, sit down with the information. You want to look at the school's expectation for each subject. So it will probably be best to look at each subject one at a time, or each therapy one at a time, and prioritize these. Say, what is my child having the most difficulty with in school? This is a great way to set, this is what we really want to focus on. The energy, the time you spend during the day should be focused on looking at the goal, the child still reaching the goals that are in their IEP. That's a great place to start, because the goals are going to tell you their greatest area of need. So you might want to take some time to reread those and keep that in the back of your mind as they're sending the work home. Obviously, the teacher should be keeping that in mind as they're sending the work home. And you really want to give this a good faith effort. So we're saying at least a week to 10 days, and that's for each and everything being sent home, just to see if you can make it work. So in this time period, you're going to identify problems. Is the internet continuing to drop? Is the information not being sent home in a timely manner? Are you being overwhelmed? Is it too much? Is it not enough to keep them busy during the day? All these things could come into play, and you want to work with the school to find solutions, because you know your child best, and you may think, hey, I have this neat trick, maybe this will work. Run it by the school, see what they think. And if you're at a loss saying, I really don't know how to solve this, reach out to the school district and tell them that. They need to know that. You need to work with them to try to solve these learning issues. And we're going to get into why it's so important to give this a good effort in a little bit. But in troubleshooting problems, reading the specially designed instructions in the IEP should really give you some good ideas to help you with your student. Does your student, for example, need breaks? Do they need a checklist to complete their work? Do they need the information, say, chunked into smaller bits? Do they need to have the information that's being given to them modified in a certain way? If that is in the IEP, then that is how it should still be delivered to your student. And one critically important thing for down the road is taking notes about what is working and what is not working, and what solutions has the school offered, and did they work or did they not work, and why? Because each and every day you should just be jotting down a couple notes about this is what we tried, this is what worked, this is what didn't, this is the subject we're just not having luck with, this is the subject that's working, this is a therapy that we just can't do this at home, but we've tried troubleshooting it. Okay, try to be cautiously optimistic about this. You may surprise yourself, and you know what? Your student will probably really surprise you. I think we have another poll.
Yes, we do. We're interested in knowing right now, how prepared do you feel to facilitate your child's learning? And it's okay if you haven't even had time to think about it. So we try to use a little humor with our responses here, but it's absolutely fine. And we'll share some resources at the end for folks who need support, and if you're not getting it from your district as well, or if you are, you need more. And I'm guessing that if we gave this same poll to families who had kids that don't have IEPs, we'd have a same range of responses. Okay, let me close that poll, and we'll go on to the next slide. Kathleen, I just want to let you know we're getting a little tight for time, so just know that. But this is great information.
Okay, so we just put this up here, the what if scenarios. We know not everybody's going to be having the same resources at home and not able to do or actually be at home. And that's okay. The school needs to know that. If you're not able to assist your child, or there's behaviors that are interfering and you just aren't physically at home, you know, there are first responders out there that just can't be home, and there is nobody there to support the child. That's okay. You need to communicate that with the school, ask for options and ask for help. Focus on what you can do, because there's a huge range of possibilities out there to problem solve. You might be surprised. And the next slide. So you want to remember that you need to, actions you take during this time of the school closure will be beneficial to you when your child returns to school, because at some point down the road, they're going to go back to school, and you may need to ask for comp ed or compensatory education. And that's going to be easier to have a discussion with the school about getting if you've tried what was offered, if you've communicated your challenges, and you've attempted to work collaboratively with the school and the school team, and you've kept notes and monitored what worked and what didn't work.
Thanks, Kathleen. I think that was really helpful information. We're also going to be putting that into a written form. We have it in an article to look for that in one of our future e-blasts. I'm not going to spend a lot of time on this, but we just wanted to quickly share some of the feedback we got from families who we surveyed. So some of the themes that we saw, and I think this maybe will just reinforce that you know, we're all in this together. Many districts are just starting or still working on figuring out the delivery of services to students. Internet service is a need, and school districts are working on getting hotspots out to folks who need them, as well as additional devices. Those equity grants will definitely help with that. Sometimes parents are asking questions and they're not getting answers, or the response is slow. Again, let's sort of start by assuming positive intent, but per follow-up if you don't get an answer, for sure. Excuse me. Some folks are getting like a weekly checklist of assignments to help organize things. One person has shared that they changed social skill goals and deliver it virtually, and it was working well. And then there are a few school districts that are not allowing video or phone calls. And again, I think they're just trying to figure out all the nuances, all the, you know, how do we maintain confidentiality, et cetera, et cetera. So those are some of the themes. And then, whoopsie daisy. This, we asked what was working. We gave some options. You can see on this pie chart that what's working, there's still the largest part of the pie is people who said nothing yet. And hopefully these will change as we move forward. But multiple modes of communication, clear, concise messaging, surveying needs of families and kids, amending those IEPs, having IEP team meetings, and providing individual supports. And this is the kind of information we are sharing with the Bureau of Special Ed. And they're making note of it, and they're passing it on to other staff so they can understand what needs of families are. And now I'm going to turn it over to Anna Pacheco to talk to us a little bit about some reminders and updates in the healthcare arena.
Thanks, Janine. Good afternoon, everyone. Buenas tardes. This is Anna, and in this unprecedented situation, we need to keep talking about the healthcare priorities for all of us. Health and safety are of utmost importance at this time. We need to remember that the protection of the health and safety of all of us is the reason for the school closing and other businesses. We have been receiving a lot of guidelines for hygiene, social distancing, and staying at home through different system organizations, especially the healthcare system. We have seen this on news, social media, and we understand that in some point this is going to get old to our children, but we need to continue doing what is being recommended for all of us to keep our health and safety. We also have to remember that we all need to work together for our healthcare system to be able to manage the actual situation. We are seeing that we are getting good weather out there, and this is going to be a challenge for each one of us and our children that may feel more isolated. But we need to keep trying these healthcare priorities and suggestions in order for us to stay well, and at some point when these crises end, to be able to enjoy the life like used to be. We have some information that also it can be put in the chat. For example, the Department of Human Services had shared information about child care centers who are still providing services for essential workers, and also the early learning resource centers in your county, they can provide information too. We also have to remember that we need to keep the calls to the 911 only for true emergency based on the actual situation. And please keep in contact. We cannot emphasize this more with your primary care physician if you start experiencing any symptoms like cough, short of breath, high fever, and follow their instructions. We are aware that the mental health needs are important component in this situation, especially because we are home. And we as a family, we have been trying different modalities to get in contact, so that will be lessen the isolation and the feeling that we are by ourselves, when the reality is that all these created ways can help us. Some families, they have been using different apps to get in contact and be creative how to do meetings, family calls, and friends, even activities. Next slide. Okay, healthcare consideration. We have to remember that also people can have other healthcare needs to take care. Please do not hesitate to call your primary care physicians to take care of those conditions, because we want for you to get to be well during this time. We have recently received more information about the Medicaid, who have temporarily approved the telehealth for physical, behavior, and mental health services. We would like to know if you have been engaging in other kind of services through this kind of system, receiving services, for example, physical therapy, occupational therapy, or any other modality. Prior to, I had noticed by personal experience that last week I received several calls for doctor appointments cancellations. And at the beginning of this week, we start receiving a lot of calls to engage in those, to make those appointments happen through virtual conference appointment or phone conference. So you have to check with your healthcare provider. It looks like we have another quick poll to see in what other kind of services you have been engaged.
Anna, you could keep talking if you want to. People were completing it while you're sharing the information, so I think that's fine.
Absolutely. Thank you, Janine.
I'll share.
So if you have any also about prescription, we have been concerned about how to refill those prescription, especially for people who have medication, who take medication in a regular basis. So Medicaid has authorized for early refills and larger supplies. But my advice or my encouragement to you is get in contact with your pharmacy to see how this goes with you. And also, please remember that the special need unit in the insurance company can be very supportive about providing information at this matter. Dental services are based on from our last webinar. We have to inform you that urgent and emergency procedures are now permitted. Please contact your dentist if you need assistance in that matter. Also, the Office of Developmental Program have lifted a lot of the restrictions regarding trainings and how to deliver services. There's a lot of information in myodp.org. Some of the changes is they are now the support coordinator visits can be done by phone or it can be done virtually. There are certain restrictions like taking going with the individual who are being supported to the community to practice the social distancing. And also they are authorizing services to be provided virtually. Especially for those individuals who live in private home and receive those services. It was also informed that one of the restrictions lifted is in the event that an individual needs to go to the hospital and get inpatient, the direct support person is authorized to stay with that person, with that individual.
Thanks, Anna. Let me just show the results of the poll real quickly, and then I'll move on to the next slide. So it does look like a number of folks have had some experiences with telehealth, either for mental and behavioral support, OT, PT, speech, and also some for medical doctors. So that's promising. That's good to know. And hopefully it's not the same, but it at least is a way to try to continue those services. Let me hide that poll and I'll move to the next slide. We are running over just a little bit. If you have to leave, please feel free to leave the meeting, but we'll provide a recording as well.
And we have to remember, everybody, that if for any reason you receive any notification denying or reducing services through Medicaid, please remember that there is an appeal process that is being filled out in 10 days. Service should be continued. But we encourage the families to get in contact. You can get in contact with us at the Appeal Center. We have a family-to-family healthcare coordinator, and any of us can provide you more information, but also you can contact the Pennsylvania Health Law Project for more assistance.
Thanks, Anna. That was terrific information. We did answer a lot of the questions in the chat, and since we're over time, I'm not going to discuss anymore, but there was one I wanted to mention. Someone asked if this information can be provided in Spanish. We will absolutely get started on translating the PowerPoints, and I believe when we're posting the videos, we'll try to see if we can get it posted with at least Spanish captioning. So we'll work on that. Thank you for bringing that to our attention. You do have access to the PowerPoint slides in the handout tab on your go-to meeting or webinar pane. There are links in this slide to many of the resources that were mentioned throughout the session. And we're very excited to announce next week's webinar. It will be on Tuesday, April 7th at 12 and at 7 again. And we have Scott Doherty, who is just a whiz with assistive technology and a great presenter. He's going to start by sharing with us 3 big accessibility features that are available across many, many platforms and how you access those. So you can register for that webinar now. And then I had one other quick poll, if you have a minute, to ask you, what are your top priorities, your top 3 priorities for additional content that we can deliver via webinar during this time. So next week will be assistive technology, but moving forward, we'd like your input. So take a minute to give us your responses, and then we will wrap up. And while you're doing that, please, if there were any questions you didn't have answered or you feel like you need a conversation, just send an email to info@peelcenter.org and somebody will reach out individually to talk with you. Thank you so much for your interest and participation today. As I said, the webinar link will be up on our Peel website page very soon, and we'll circulate that and you can share it with others. All right, well, let me just show you what everyone's interested in here, and then we will say farewell for now. So, yeah, that says special design instruction, definitely at the top of the list. We are, we're already thinking about and working on gathering information and resources that will help. So I'm guessing the webinar week after next is probably going to be on that. Thanks, take care, and have a good rest of your afternoon. We do have some sunshine here in Pittsburgh today, so at least go outside, just, you know, keep your distance.